We're going to all get through this, and the best way to get through this is to all do our part, both the older patients themselves, but also their families and all their friends. And to keep the elderly population safe as possible, there are 3 key steps to try to keep them safe. One would be to really do the social distancing and keep them at home as much as possible, whether it's for social contact virtually, whether it's with their medical care, but staying at home right now is the safest thing. A second is very careful hand hygiene. So soap and water 2 or 3 times a day is the best. Hand sanitizer is certainly good, but soap, which is a simple and cheap method, is the best at getting rid of this virus on people's hands, which is one of the main ways it's transmitted. And finally, to screen any visitors, to really make sure that any visitors that they have contact with are screened for fever, respiratory symptoms, because it is a relatively contagious virus, and you need to carefully screen who you're in contact with. The key symptoms, which are most common, are fever, probably over 100.5 or so, or higher, and new respiratory symptoms, a new cough, new shortness of breath, new sore throat, things that they haven't had before that fever. Those are the most common. It can cause some GI upset, but that's relatively rare. And if you just have a runny nose and a sore throat without a fever, it's less likely to be coronavirus. The first step to diagnose coronavirus is the clinical symptoms, fever, and new respiratory symptoms. A second step is, have they had contact with anyone known to have the coronavirus? And then ultimately, you need to have the diagnostic test where you put a little swab into the back of the nose and send that off to test for the DNA of this virus. Those tests are not as easily available as I would like. It's starting to come more online in our area, but it's still important to ask your primary care provider, do they have access to that test? And if not, there are some testing centers now in the region that are cropping up. Social distance and physical distance works. You have to screen people and stay away from anyone who has a fever. You have to carefully wash your hands and unfortunately stay 6 feet or so away from other people. Now, of course, within a family or within intimate relationships, that may not be possible. So we have to accept the fact that within our home, there may be some risk of transmission, which is hard to avoid. Yeah, so older patients, particularly those over 80, are more vulnerable because their underlying organ systems are weaker. They may have heart failure, lung disease, kidney trouble, or dementia, and be frail. And because of that, if they get sick from the virus, they're more prone to sepsis and their system shutting down. And that's why their mortality rate is higher. I would say that the good news is that even in that population, 80 to 90% of patients over 80 who get this illness survive. So that's the good news. The other way to look at it is that 10 to 20% from most literature on the epidemic at this point die. So in the younger populations, it's more like 98 to 99% survive. And that's the difference between the older population and the younger. One, I just want to acknowledge people are scared and they think the little bit of cold or sore throat or low fever means they're going to die. And that really is not true. Most of the illnesses we have right now are not coronavirus, but it is present. So you have to have good information about what symptoms are suggestive of this disease. Get in touch with your medical provider, preferably in the home environment, as soon as you can to ask questions and to get tested. And then try to talk about your fears and anxiety. Talk to your family, try to name those feelings in your family members so that they can talk about it. Because when it's held inside, I think the stress really builds up. People get more tense and kind of anxious than ever. So really getting it out into the open is probably the most healthy thing. I think the first place I would go is to make sure you're in close contact with your primary care provider. If it's with Capital Caring Health, call us. We have televideo visits. We can make in-person visits if needed to find out, do you have testing available? Do you continue to make visits? And answer questions about how to prevent the illness. There's also a good website, probably the best reliable one is the cdc.gov website, but I would actually recommend folks talk personally to their primary care providers to get the best advice. So primary care at home for elders is good at any time of history, but particularly now. Primary care at home is a team of a doc, nurse practitioner, and social worker who visit elders at home and provide medical care and social supports until the last day of life. It's available from Capital Caring Health in Northern Virginia, kind of the McLean, Falls Church, and Arlington regions, as well as Northwest DC and Chevy Chase, Maryland. We provide primary care visits, whether it's by phone, video, or in person. And we actually are available 24 hours a day for any concerns. We manage care until the end of life, and we involve hospice as needed. And we have a great hospice partner here at Capital Caring Health as well. To find out more about primary care at home, you can call our 1-800 number, which is 1-800-869-2136, or go to our website at capitalcaring.org/PCH.